Cervical erosion. It sounds scary, right? The term itself can be quite intimidating, conjuring images of something being worn away or damaged. But don't worry, it's not as alarming as it seems. In fact, it's a common condition that many women experience at some point in their lives. The term erosion is actually a bit misleading. It doesn't mean that your cervix is being eroded away or damaged. It refers to a condition where the cells from inside the cervical canal, which connects your vagina and uterus, grow on the outside of your cervix. These cells are called glandular cells, and they are different from the squamous cells that normally cover the outside of the cervix. Imagine your cervix like a donut. The inside of the donut hole has a different lining than the outside. The inside of the donut hole has a different lining than the outside. In cervical erosion, it's like the inside lining is peeking out. In cervical erosion, it's like the inside lining is peeking out. This can sometimes cause symptoms like increased discharge or slight bleeding, especially after intercourse. This is usually harmless and often goes unnoticed. Many women have this and don't even know it. Many women have this and don't even know it. It's often discovered during a routine pelvic exam when your doctor is checking for other things. It's often discovered during a routine pelvic exam. If you do experience symptoms, they are usually mild and can be managed easily. Rest assured, in most cases, it doesn't cause any problems and doesn't require treatment. Your healthcare provider can offer reassurance and guidance if you have any concerns. Let's talk about HPV, or human papillomavirus. It's incredibly common and usually harmless, clearing up on its own. However, certain types of HPV can lead to changes in the cervix, increasing the risk of cervical cancer. Think of HPV like the common cold of the genital area. Most people will have some type of HPV in their lifetime. Just like with colds, our bodies often fight off HPV without us even knowing. However, in some cases, HPV can linger. This persistent infection can lead to changes in the cells of the cervix, which can sometimes develop into cancer if left untreated. Inflammation is your body's natural response to injury or infection. It's like your body raising a flag to say, hey, something's going on here. When it comes to cervical health, inflammation can be a sign of various things, including HPV infection. Remember, not all inflammation is bad. It's actually a crucial part of your body's healing process. However, persistent inflammation, especially when caused by HPV, can lead to changes in the cervix. Think of it like a small cut on your finger. It might get red and swollen, but it usually heals quickly. But if the cut gets infected and the inflammation persists, it can cause more serious problems. There are many myths surrounding cervical changes and their treatment. One common misconception is that treatment is always painful or invasive. This is simply not true. Modern medicine offers various treatment options, many of which are minimally invasive and well tolerated. Another myth is that treatment will affect your fertility. Again, this is not necessarily true. Doctors prioritize preserving fertility whenever possible, especially in younger women. It's important to remember that every woman is different, and treatment plans are tailored to individual needs and circumstances. Open communication with your doctor is key to understanding your options and feeling confident in your care. Section 5. Your checkup, your power. The importance of regular cervical exams. Regular checkups are your superpower when it comes to cervical health. Pap smears and HPV tests are essential tools that can detect changes in the cervix early on, when treatment is most effective. Think of these tests like routine maintenance for your car. Just like regular oil changes can prevent major engine problems, regular cervical screenings can help prevent cervical cancer. During a pap smear, your doctor gently collects cells from your cervix to examine them for any abnormalities. It's a quick and relatively painless procedure that can make a world of difference in your long-term health. Section 6. Decoding the signs, what to watch for in cervical health. While regular checkups are crucial, it's also important to listen to your body and be aware of any unusual symptoms. Regular screenings like pap smears and HPV tests are essential, but they are not the only tools in maintaining cervical health. Being proactive about your health means understanding and recognizing the signs your body may be giving you. While cervical changes often don't cause noticeable symptoms, there are some signs to watch for. These signs can sometimes be subtle, so it's important to pay attention to any changes in your body. Early detection can make a significant difference in treatment outcomes. Abnormal bleeding, such as bleeding between periods or after intercourse, can be a sign of cervical changes. This type of bleeding is not normal and should be discussed with your healthcare provider as soon as possible. It could be an indication of an underlying issue that needs to be addressed. Unusual discharge, pelvic pain, or pain during intercourse should also be checked out by your doctor. These symptoms can be caused by a variety of conditions, some of which may require immediate attention. Don't ignore persistent or severe symptoms. Remember, these symptoms can be caused by various factors and don't necessarily indicate a serious problem. However, they should not be dismissed without proper medical evaluation. Your doctor can help determine the cause and provide appropriate treatment if needed. However, it's always best to err on the side of caution and consult with your doctor to rule out any potential issues. Early intervention can prevent more